Welcome to IJN HeartNews, bringing you the latest advancements in cardiac care from the esteemed Institut Jantung Negara. Today, our skilled medical professionals have become the first in Malaysia to employ the cutting-edge Evolut FX system to treat patients suffering from severe aortic stenosis. Aortic stenosis is a serious heart condition where the aortic valve leaflets become narrowed, preventing them from opening and closing properly. Over time, this imposes a significant strain on the heart's pumping mechanism. Severe aortic stenosis is usually treated with a procedure called transcatheter aortic valve implantation, or TAVI, a minimally invasive approach that allows doctors to treat a diseased aortic valve without requiring open heart surgery. Research shows that aortic stenosis impacts women differently than men, and published data shows that women are 12 to 35% less likely than men to receive the available treatment options of either transcatheter aortic valve replacement or surgical aortic valve replacement to treat the condition.
There are two types of aortic stenosis. One is the congenital type, which happens in babies, and eventually when they become adult, the valve area becomes smaller and they will present with aortic stenosis. Usually this congenital type has 2 leaflets instead of the normal 3 leaflets aortic valve. So if you can imagine, this abnormal leaflet cannot last for very long, so normally after 40-50 years they will start to become smaller and patient presents at that age. The other type is the degenerative aortic stenosis, which means that this valve, even though it is normal when they were born with 3 leaflets, after some time the narrowing become worse and start to have calcium deposits, and eventually the valve area becomes smaller before they have the symptoms. Patients with aortic stenosis would present with 3 common symptoms. First of all is angina or chest pain, especially during exertion. Symptom number 2 is that they can present with difficulty breathing on exertion. When they start to walk, they start to climb stairs, they will feel difficulty in breathing. And symptoms number 3, they can present with syncope or fainting episodes, or usually happen suddenly. Aortic stenosis is a condition where the valve area becomes smaller after a period of time. A normal valve is about 2.5 until 4 centimeters square area, and it becomes stenosed, and eventually it will become severely stenosed if it is less than 1 centimeter square. So that is the definition of severe aortic stenosis, which is less than 1 centimeter square area. If aortic stenosis is untreated, it becomes more severe. If it is 1 centimeter square, it will become 0.9, 0.8, even 0.5 centimeter square over many months or many years. If we do not treat this, the heart will fail. Because the heart needs to pump against a small area of outlet. Therefore, the heart will become larger, bigger, and eventually it will fail. And the symptoms will be like leg swelling or difficulty breathing, or even unable to lie flat.
The Evolut FX System by Medtronic is the latest game-changing technology aimed to assist the TAVI procedures. Its redesigned delivery system offers enhanced flexibility, control, and improved visualization, the key features that allow for more precise and predictable deployment of the TAVI valve. With this technology, interventional cardiologists can now implant the TAVI valve with greater accuracy and control, significantly reducing the risk of obstructing the critical coronary artery openings. Recognizing the gap and underrepresentation of women in clinical trials, the SMART trial, the biggest trial of its kind that mainly focuses on women, was conducted to study how valve design can benefit patients with small annuli. Published in the New England Journal of Medicine in April 2024, the first-year findings reveal that the Evolut FX valve significantly improved outcomes for this patient group.
Aortic stenosis is simple to diagnose. Usually the doctor will be able to tell if there is a possible aortic stenosis by only listening to the heart by using their stethoscope. Because of the severe narrowing, there will be an abnormal sound or a heart murmur that can be heard. And to confirm that, we can use an ultrasound or what we call echocardiogram to actually look into the valve at the morphology, and then we can measure the area, which is the valve area, by using a Doppler method, and by then we can quantify how severe the aortic stenosis is.
Institut Jantung Negara remains steadfast in its commitment to delivering exceptional healthcare services, ensuring that every patient receives the highest standard of treatment. By embracing the latest technological advancements, such as the Evolut FX System, this esteemed institution continues to lead the way, offering hope and healing to those in need.